Any infection can lead to sepsis in anybody at any time, and sepsis is a medical emergency that can cost your life. It's important that you learn the signs and symptoms. I lost both of my feet and 7 of my fingertips to sepsis because I didn't know the signs and symptoms. Let's make sure that doesn't happen to you. Sepsis has been shown to be at least 20% of the deaths that take place every year worldwide. That's a huge concern and a huge possibility that you'll encounter it in your lifetime. Please learn these signs and symptoms. It is so important. Let's start with the basics. At Sepsis Alliance, where I'm on the board of directors, we use the acronym TIME, T-I-M-E. T is for temperature, which can be high or low. If you know my story, I thought that you had to have a fever in order to be sick, but it turns out that with sepsis, your temperature can be high or low. I did not register a fever. I didn't notice that it was low. So if you don't have a fever, keep looking. It doesn't mean that you're not sick. I is for infection. Sepsis happens when you have an infection, but keep in mind, you don't always know if you have an infection. It could be internal in your body, but if you do have an infection and it's getting worse, keep an eye on it and seek help if you have other signs and symptoms. M is for mental decline. If a person seems like they aren't acting themselves, they seem like they have signs of dementia, or even they seem drunk and slurred speech, that's a problem. Their brain isn't getting enough oxygen. Get them to the hospital and get them help immediately. The E in time is for extremely ill. If a person has flu-like symptoms and they say something like, I've never been so sick, or I feel like I'm going to die, trust them. Get them to the hospital. It's better safe than sorry. I mentioned that mental decline was a sign that your body's not getting enough oxygen, your brain's not getting enough oxygen. Another way to notice those symptoms is by taking your heart rate and your breathing rate. Even just noticing if a person seems out of breath or they're having difficulty breathing, that's a sign that they're not getting enough oxygen. So labored breathing or breathlessness, that's a big symptom. I have even done this over the phone for my elderly parents and my kids away at college. Flu-like symptoms are also a big red flag. Now, in order to differentiate from just the common flu, if they have the flu and they have an infection that you know about, or they have a racing heart rate, or they have some of these other symptoms, that's a big sign to get them to the hospital. Flu-like symptoms would be extremely tired, really drowsy, vomiting, stomach aches and pains, just general body aches and pains. Low urinary output is a sign that your kidneys are having difficulties. So that's another big red flag. If a person has cold feet and hands while they're feeling sick and they have an infection, that's a big red flag. Also, tingling or pain in their extremities, which is their hands or their feet, that's huge. Get them to the hospital immediately. That is not normal, and it's a sign that their fingertips and their feet are not getting the oxygen that they need to survive. That's what happened to me, and you know where I am.